Hey there, it's Dr. Hire. Just wanted to take a quick minute to help you understand how you can test for yourself what foods you might be sensitive to. And you can see in other videos we talk about the difference between a food allergy and a food sensitivity. Obviously, there's different types of tests that we can do, hair, blood, different types of analysis, but there are some things that you can do for yourself at home. They are a little bit more time consuming and labor intensive on your part, but they're certainly economical and free to do if you have a half an hour or 45 minutes. So let's say you're not sure about what foods you might be having a reaction to or you're sensitive to. Well, there's this testing method called Coca's pulse test. Coca's pulse test. And what you're going to start with is you're going to take your own pulse for a full minute, a full 60 seconds. You're not going to do it for 10 seconds and then times 6, or to do it for 15 seconds and times 4. You're going to take the pulse for a full minute. And the most easiest place to find your pulse is on your wrist, be your radial pulse. You may be able to find that, or other places even at your neck or the carotid, but it's just easiest on your wrist. And you're going to find your pulse and you're going to count that for a full 60 seconds. So let's say you have a timer on your watch or your phone, and after that 60 seconds, let's say I get a score of 60. Let's just make the numbers easy. I'm going to do this 3 times because I need to have an average to develop a baseline. So let's say I do it a second time and my score comes in at 61. And my third time, my score comes in at 58. So I have 60, 61, and 58. I'm going to throw out the high, I'm going to throw out the low, and my average is 60. So this is my baseline. Now what you're going to do is you're going to take a list of foods that you eat on a regular basis. I just threw a couple up here. You may eat eggs, tomato, bread, or dairy, and that could be cheese or milk or ice cream or anything like that. And what you're going to do is you're going to take, let's just take a slice of tomato, and we're going to chew that tomato for 10 to 20 seconds. Just chew it up, chew it up, chew it up, and you're going to leave it in there. And then you're going to take your pulse again for a full 60 seconds. Now, let's say, right over here, let's say my pulse went up to a 62. Okay. Now, I'm going to rinse my mouth with water. You can swallow or spit that out, whatever. Rinse your mouth with water, clean your palate, and let's take a piece of bread. I'm going to chew that up, chew, 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 for 10 to 20 seconds. I'm going to take my pulse again for a full minute. And let's say the bread went up to 64. Again, spit that out, rinse your palate, and then you can do as many different foods as you want. And let's say we did dairy, and dairy actually went up to 66. So what does this mean? Well, our baseline is 60. If the pulse goes up 1 or 2 points, kind of like it did with tomatoes, probably not too much of a reaction with your body. But anything that goes 4 or more, like the bread went up 4 points, and the dairy went up 6 points, definitely when you start seeing 4 or more, your body is hypersensitive to that particular food. Now, you can go through your whole refrigerator and your pantry if you really want to. Just sit here and make a list and write down next to them what your pulse is, and you can see very quickly what foods you should be eliminating from your diet or keeping out. Now, if you've done a detox or you've done some type of 2-week detox or a 3-step detox, after a period of time, you can retest these foods, and many foods that tested high may actually come back with a lower number. And that means you can reintroduce that food into your normal diet and your normal menu. Okay, so again, that's the Coca pulse test. Take a baseline pulse for 3 times for a full minute, and then chew and taste the food and retest your pulse and see if that increases the sensitivity. All right, thanks for your time. Have a great day.